In 2008, the Zuellig Family Foundation came up with an approach to help achieve better health outcomes for the poor. Called the ZFF Health Change Model, it proved effective in bringing down maternal deaths in its prototype partner municipalities. The approach is premised on the assumption that a transformed health leadership will lead to much-needed reforms and make local health systems responsive to the needs of the public, especially the poor. ZFF uses the Bridging Leadership Framework to give leaders like mayors and municipal health officers the skills and knowledge to systematically address health challenges in leadership and governance, health workforce, health financing, health information systems, access to medicines, and health service delivery. As health systems improved and maternal deaths dropped in its prototype municipalities, national maternal mortality ratio remained stubbornly high. If ZFF's health change model brought significant changes in the health systems of these poor municipalities, can the same approach work elsewhere in the country? In May 2013, a joint initiative was forged between the Department of Health and ZFF. This unprecedented partnership will allow the replication of ZFF's health change model in hundreds of local government units identified by the National Anti-Poverty Commission. As soon as the ink dried on the partnership deal, work began for the implementation of the Health Leadership and Governance Program, or the HLGP. Meetings with DOH officials were regularly held. Policies were crafted. Training modules were vetted with the DOH. Academic partners, whose faculty will run the training program for mayors and municipal health officers, were identified. HLGP was introduced to officials of the regional offices. As implementers of the program, the DOH regional offices have been key to the outcome of the HLGP. How did regional leaders perceive the program?
Alam ko po yung bridging leadership. I firmly believe the value of HLGP. Bridging leadership is one critical intervention that I think would push for the engagement of our mayors and eventually the provincial governor.
When I was a municipal health officer, nakita ko yung hindi pagkakaugnay, pagsama-sama ng mga local health officials and also the local chief executives. Nung nakita ko yung programa na HLGP, I think this will be the answer to this.
While the HLGP had the immediate buy-in of some regional directors, others, understandably, had their doubts.
I was at first apprehensive in the implementation of this program, considering that there were no studies conducted and we were not provided with the results.
Despite some doubts and challenges, HLGP was rolled out. And just how did the regional offices manage the implementation?
We allocated funds for the activities. We have given support to our development management officers in their activities. We then assigned a coordinator for this. Director Baluma has insisted that even the accountant, the budget officers should attend to this training. Ang sinasabi is kailangang maunang matransform ang ating mga tayo sa region para mas maganda yung ating pagbibigay ng transformation at the local level.
We had to advocate what this bridging leadership is, no? At ang unang change makita sa akin yung pagbabago, mas bumaba siguro tayo kasi masyado tayong stricto, masyado tayong mataas. Nagkaroon ako ng tinatawag nating guiding coalition. These are more second level na pwedeng makabulong sa akin at nagbabalidate, nag-grounding sa akin.
I have a lot of persons to thank for as far as the implementation of PLGP and the HLGP is concerned in Region 6. First is our planning officer. So she was very insistent that we have to implement it. And with her is our DMO.
The initial phase is how to really convince our local chief executive and municipal health officers to attend, especially that they have to stay in the sessions for a long time.
If we have to engage the mayors, you should be politically savvy para ma-convince mo yung mga mayors na ito yung dapat nating gagawin, because it's not only implementing the program, but it's really bringing in the community.
We have also made the coaching for our DMO by guiding them also with the constant sessions. And also we provided time allotment for really visiting the mayors and municipal health officers.
Maganda yung approach kasi tinutukan lang natin yung 6 building blocks of a health system. Paano natin ma-ensure na kailangan may tao, kailangan may finances, kailangan may local health board. At naintindihan nila yan. At the end of 6 months, nakita nila yung improvement. At the end of 12 months, nakita nila yung red nila na indicator nagiging green.
So that's why
The MLGP graduates were able also to transform their barangay leaders through the barangay health management program. All the barangay leaders in their area were able to make plans, and they were also able to create barangay health boards.
I think this is one good thing also about the program. Yung communication lines are better because of the mentoring, the coaching, of the scorecard that we need to look at. The hospital scorecard, for instance, is not only the hospital scorecard. How does it relate to referral from the community? Then the community also can better relate with the hospital.
At first, maliit lang yung expectations natin because hindi natin ma-expect na yung ating mga mayors will be attending and sitting down for the duration of the session. Ganon din po na magkasabay yung ating municipal health officer at ang ating mayor. But they were able to do so. We believe that transformed local chief executive becomes our resources for the future mayors. They will be the marketers, the sellers of MLGP because they have done well.
This is one way where the HLGP becomes unique because at different levels it tries to address questions, and in the end, ang target talaga natin better health outcomes.
We had 25 municipalities in Region 3 who participated sa MLGP. At nakita natin na successful sila. Successful sila in terms of the recent election. At the same time, successful sila in achieving the objectives of it's a specific program.
We hope to replicate this not only region-wide but nationwide. So if we have to replicate it, a corresponding budget should be included in our plans. Most of all, to really sustain the implementation of HLGP in the region, we coordinated with the regional office of DILG, and this indicator for HLGP is integrated in the Excellence for Local Governance Award of DILG in Region 6.
I think it's the bridging leadership. It is the governance thing para maipagpatuloy yung health reforms, di ba? Magaling na tayo sa programa. Nag-i-improve na rin yung mga ospital. Nag-i-improve na rin yung mga financing because of PhilHealth at saka lumalaki na rin yung mga investment for health. Pati nga yung pondo ng gobyerno, both national and local, lumalaki na rin. Yung information system, nag-i-improve na rin ng konti-konti with technology, with e-health. Ang kulang na kailangan magtagpi-tagpi sa kanila, governance. Kasi hindi natin mapapagalaw lahat kahit na nandito na sila kung walang governance, kung walang magli-lead. Kaya this is the beauty of the HLGP na kailangan nating ituloy.
Upscaling the health change model at the national level will surely enhance our ongoing KP High Five initiatives.
ZFF wishes to see more local chief executives with greater accountability for the health of their people and working collaboratively with stakeholders, so no poor Filipino dies again without ever seeing a doctor.